Welcome to Community Taking Action, ABCD's program highlighting people and organizations doing great things in and around the Boston area. Joan, welcome to the program.
Thank you so much, and thank you for having me here today. This means a lot to us.
Well, we're very excited to have you, particularly because I don't know if the viewers are as familiar with not just ABCD Health Services, but your tenure as someone who's been an advocate for health services in this area. And I think we want to make sure people know that.
Our main goal is to give people the information that they need and the resources that are available and connect the folks with the resources. And our niche is really contraception management, family planning writ large, which includes all of the counseling, the STD, the HIV prevention. These are difficult things, I think, often for parents to talk with the young people about. There's not as much education as we'd like to see in the schools, although at this point I'd really like to commend Councilor Presley, because actually she passed some legislation to make sure that young people in the Boston Public Schools, particularly at the high school level, are getting the information and resources they need.
Nice.
And we've worked very collaboratively with her. So that's an example of our work with policymakers, because no one can do anything alone.
You talked to us and gave us an intro on Lower the Sound, and I gathered that you and James have been doing this for some time. Welcome, James Owens, who is a board member at ABCD. Get us up to speed on the Lower the Sound campaign. I understand that you had some observations and thought that ABCD and the health services might need to step up to the plate. How did that come around, and how long have you guys been doing this?
I was sitting on my back porch a number of years ago now, and you hear the noise, the house is shaking, the street is shaking, which is not unusual, but
Right.
then the car parked right near my house, and two little kids emerged from the back seat, and it dawned on me, like, those kids, if they're not deaf already, they soon will have their hearing impaired, and their parents are not even gonna realize that this exposure is damaging their hearing. So being a chairman of the Health Services Committee with ABCD, I said we should come up with some way of turning the light bulb on for the general public, get them to understand that this exposure is detrimental to their health, their hearing, and the education of their children. Because a lot of kids are in school, you think they've got a problem, and it's probably because they're not hearing what the teacher's saying.
Right.
Their hearing has already been damaged.
And they're even showing something that I had thought of years ago, but that loud sounds can really cause high blood pressure, can be a factor in that. Obviously, the sounds of the city, the jackhammers, the construction, all of that going on is very detrimental too, and particularly for anyone who has occupational exposure over time. Happy to see more folks using and not being ashamed to use earplugs. They're selling them in the drugstores right next to the dental floss, pretty much.
Well, you mean to block out sound?
To block out the sound.
Is there a target audience for the message?
It really is younger people, children obviously, and to help parents also understand what some of the risks and dangers are. Perhaps by the time someone is middle-aged, the damage has been done. And then young people, I think teenagers are perhaps some of the target group that's most at risk.
I mean, headphones are big
Prevention.
business. I mean, young people who
absolutely.
have, certain brands of headphones that they really like to get. You can tell by the color, or the ones are
Yes.
wireless,
Yeah,
and
definitely.
there's some
Definitely.
fantastic.
True, but you don't have to listen to the music that loud. Now, I was in my automobile on Warren Street near Grove Hall, and my car doesn't have a radio in it right now, so I could hear everything that was going on. There was a young man across the street sitting at the bus stop with headphones on his ears. I could hear his music.
Wow.
And I knew just from that one, the music was too loud. Secondly, he's already damaged his hearing.
And the only time we talk about hearing is when you take that hearing test with the chimes and
Correct.
stuff.
Which they don't always give in the schools. We found that out too.
Really?
We were quite surprised that it didn't happen all the time. Obviously in our Head Start program, hearings, vision screenings,
Vision and hearing.
but not all young children get that, are able to have that opportunity. So we developed a series of workshops with some experts. That was very exciting because it did really pique people's interest, I think.
What are the goals of the campaign? What do you hope to accomplish by the brochure and all of the work that you guys have done and are doing and resurrecting given new technology.
Get people to turn the sound down.
It's it. Lower the sound, save your hearing.
Lord, it sounds safe you're hearing. What are some of the risks? I imagine a brochure talks about what happens with prolonged exposure to loud sounds.
Well, essentially, the tiny little hairs in someone's ears get damaged, and it causes permanent damage. And so what we really want to do is prevent beforehand.
When you mention the damage to someone's ear and you mention hair in the ear, I think for our viewers it may be surprising. Well, what do you mean I have hairs in my
Well, there
ear?
are these, not the hairs that perhaps people find cosmetically unattractive, but way deep inside the anatomy of the ear. These are the little hairs that vibrate for the sound. So if you think about, how strings are on an instrument, these are comparable within the human ear. And so that's what gets damaged.
Yeah, the cilia, they're called
The cilia.
cilia.
Wow. And is there what does the campaign encompass? And we talked about what you're doing. Are you going to grow the campaign and kind of?
Definitely. In a campaign like this, all stakeholders need to come together. Industry, health professionals, health educators, schools. The plan is certainly to involve more elected officials at the city and state level. We already have some collaboration with the Department of Public Health. And thank you for letting us come on this show, because this is what we'd like to do, is media outreach. Thank you for having us.
Thank you very
much.
much.
Appreciated.
My pleasure. That concludes our program. Be sure to follow us on Facebook, Instagram, and Twitter. And if you've missed any episodes, you can always get them on YouTube. Thank you for watching Community Taking Action. I am your host, Eric Mitchell. Until next time.